Good morning, doctor. My name is Joshua, and this is my son Steve. He's 4 months old.
Good morning. I'm Dr. Prasad. What have you been here referred for?
In his right eye, he's been watering and tearing excessively since he was born, and sometimes there is discharge.
Does the tearing get worse when you're outside in the wind or when he cries?
Definitely, when outside in the wind, becomes very bad out of his right eye.
Yeah. So he's tearing up excessively, so it's Epiphora. It's the medical term for excessive tearing. So because he's an infant, the most common cause would be a nasolacrimal duct obstruction.
So what causes that? Is it something serious?
No, it's not serious. Most infants, around 20% of the infants who are born, they have nasolacrimal duct obstruction. So it's the duct responsible for draining your tears to your nose. And when it's in these kind of infants, they're partially opened or not completely opened. And instead of draining into your nose, they come outside to your cheeks and they spill off. And there can be some kind of mucus buildup in some patients, but it's not really seen in Steve.
I see, that's what's been happening.
Yeah, so let's take a quick look at Steve. There's no redness or swelling, which is good. And I see there's a buildup of tears and mucus discharge on the inner corner of the eye. When I press the lacrimal duct, there is mucus spewing, which is a classic sign, really.
So what does that mean?
So it basically confirms my diagnosis. There is obstruction on the nasolacrimal duct because the pressure test became positive. And this is due to the duct not being fully opened in infants of this age.
So could it be dangerous? Can his eyesight be damaged?
No, not at all. Most of these cases are benign and they resolve by themselves when the baby turns 1. So, but we have to look out for signs of infection, which could be redness, swelling, which could indicate there is infection on the nasolacrimal duct. But in cases like Steve, it usually doesn't happen.
Is there anything we can do in the meantime?
Yeah, basically we do conservative management at this age. So there's 2 things you can do, that is the lacrimal duct massage. And if there is any kind of buildup of pus or you see any pus being spewing through his eyes, you can clean it with a warm cloth. And I'll show you how to do the nasolacrimal duct massage. So basically you take your index finger, you apply pressure on your inner corner of the eye, and then you drag it towards your nose. And you do this to the baby 3 to 4 times per session, around 4 to 5 times a day. And this should usually help to open the nasolacrimal duct by forcing the pus through the passage.
Do we need any eye drops or medication?
If there's no signs of infection, usually not. But if you see the buildup of pus being thick, greenish, yellowish in color, or you see any kind of redness or swelling around the eyes, then we could prescribe antibiotic eye drops, but for short time only.
So how long should we try the massage?
The conservative management usually goes on until the baby is 9 months to 12 months of age. And even after that, the nasolacrimal duct hasn't been fully opened, we'll consider doing a probing procedure. It's a surgical procedure done under brief general anesthesia.
Oh, I don't want to do that.
I understand your concerns, but it's usually fine. The surgical procedure has high success rate, over 90%. It's done quick within 10 minutes, and it's done under general anesthesia as well. So you have nothing to worry about.
But for now, we should just do massage and observation.
Yeah, we'll just do the massage and observations, and we'll have follow-ups after every 2 months to check for the progress. And after 12 months, we'll discuss about the surgical procedure, if you want to do or not.
Thank you so much, doctor. This really helps.
Yeah, feel free to contact me if you have any doubts or details.